All right, so this is actually pretty common overlap with neurology and psychiatry. So, traumatic brain injury or chronic traumatic encephalopathy, which is kind of ongoing process, right? Take one traumatic brain injury, it kind of makes the brain inflame. And the last part is frontotemporal dementia, which is there's a very controversial person that they speculate has it, and based on multiple things. So, it's a spectrum of condition where the brain can trigger progressive mental health issues and neurological decline. So, mental health concerns by stage. So, traumatic brain injury. It's immediate and short term uh, mental health effects on major, which can include major depression, anxiety, PTSD. Several cases may lead to personality changes or extreme irritability, apathy. Chronic traumatic encephalopathy. This condition may manifest in two stages. Early, early in life, and this actually happened with Aaron Hernandez, who's a very famous football player. He obtained the most CTEs for a person of his age, which led to a lot of his behaviors. So, early in your 20s and 30s primarily affects mood and behavior, depression, anxiety, impulse behavior, aggression, which was definitely shown in his documentary. Late around age 60, shifts towards cognitive decline, excludes memory loss, and progressive dementia. Frontotemporal dementia, primarily a behavioral and language led dementia. Um, Behavioral variant, loss of empathy, apathy, often mistaken for depression, and inappropriate social behaviors. So one of my patients does have this, but luckily, through correcting her depression and anxiety, it really has prevented her condition from getting worse and worse. Um, so, so a lot of times it's about retraining your brain. It's not going to go away, but the degree to which it declines is much different. So, structural atrophy in frontotemporal dementia and late stage CTE cause the frontal and temporal lobes to shrink. These regions are responsible for social skills, judgment, and emotional regulation. Um, Protein accumulation. FTD is defined by unique clumping of tau protein and blood vessels in the brain folds. FTD involves buildup of these same proteins, which lead to the death of nerve cells. Um, so it disrupts the neurotransmitters communicating from one another, and a TBI can trigger frontotemporal dementia, which was happening in my patient's case, where she went through multiple car accidents, and it definitely impacted her ability to process working memory. And so a lot of those things can coincide. So it's important to get yourself evaluated if you ever have hurt hit your head or anything like, or taken a fall, because it definitely does affect the outcome.